In studio today, we have Dr. Mohammed Khan here from Springfield Clinic Cardiology. Dr. Khan, thank you so much for being here.
You're welcome.
Yes, okay, February, it's Heart Health Month, so you're here to talk about an important aspect of our bodies, the heart. First, talk about why is it so important to make sure your heart is healthy?
Well, the heart is the central organ of the body that supplies blood to all the vital organs. If your heart is not working well, you're not getting good blood supply to the rest of your body, and then it is the mortality for the heart disease is the highest among any disorders that we have.
What are some of the common things that you see when patients come to you about why they have heart issues?
So it's a complex interplay between genetic factors and environmental factors. Obviously, we cannot change our genetics, but the environmental factors like smoking, lack of exercise, unhealthy diet, uncontrolled blood pressure, uncontrolled diabetes, all those things play a major role, and then they accelerate the process of plaque buildup in your arteries, and that eventually leads to heart attack and decreased heart function. And that's usually the most common presentation and the risk factors that we see.
And is that something common that you see over time? If you're, smoking, not working out, can this happen to you within a year, or is this something that if you've been doing it for years?
So it usually takes years to develop significant blockage. The process usually starts in 40s, and then it gradually goes to the 50s, 60s, and 70s. But most of the heart attacks that we see, they happen in early 50s or late 50s or early 60s. But lately, we've been seeing people coming to us in 40s or actually late 30s. And I think that part of it is this epidemic of obesity. Not eating well, consuming high energy food, and not exercising. So the age is actually shifting towards younger people. And the younger people usually present with a massive heart attack, as opposed to someone in 60s and 70s. They have more like a stable presentation with shortness of breath and gradual plaque buildup, as opposed to young people who have like a massive heart attack because of the plaque rupture.
Yeah, and then let's talk about the signs and symptoms. I want to get into this. If somebody is feeling chest pain, or what are some of the things they should look out for before they see a doctor?
Yeah, absolutely. As you said, one of the most common symptoms and one of the most serious ones is the chest pain, chest pressure. If you have this sensation of chest heaviness or tightness, especially under stress or when you exercise or exert yourself, don't take it lightly. Many times people think it's a heartburn, it stays for like 10-15 minutes and then it goes away. That's actually a typical presentation of having a blocked artery, and then that indicates an impending heart attack. So take it seriously if it is persistent, and especially if you have family history of heart disease, smoking, you have high blood pressure or diabetes. In addition to chest pain, other symptoms are shortness of breath, dizziness, sometimes palpitations, swelling in ankles. Those are other common things, but the chest pain, as you said, is the most common, serious
common
one. Yeah.
Dr. Khan, thank you so much. Valuable information here, as February is Heart Health Month, so definitely be on the lookout for those symptoms.
All right.
Okay. Coming up next on Fox, an unlikely pair